Falling ill overseas is a situation even the most prepared professionals can face. Travelers' diarrhea affects up to 80% of visitors in high-risk areas. Respiratory issues, injuries, and more serious emergencies remain common. In this briefing, we outline a clear, step-by-step emergency protocol. This draws from guidance by the CDC, the U.S. Department of State, and established travel medicine standards. The goal: support your safety, fulfill organizational duty of care responsibilities, and enable efficient recovery. Let's walk through the protocol, one step at a time. Step 1. Assess your symptoms and determine severity right away. Pay attention to these key signs. Fever above 101 degrees Fahrenheit, that's 38.3 Celsius. Persistent vomiting or diarrhea, more than 6 episodes in 24 hours. Severe abdominal pain, difficulty breathing, chest pain, confusion, signs of dehydration, dry mouth, dizziness, reduced urine output, blood in stool or vomit, or worsening of any pre-existing condition. Mild issues, like basic traveler's diarrhea or light respiratory symptoms, often resolve with rest and hydration. Severe symptoms require prompt medical help. Here's what people often miss: underestimating dehydration or secondary complications. Take a moment, document the onset, how symptoms are progressing, and any recent exposures: food, water, insects, crowds. This information helps providers later. Step 2. Initiate immediate self-care to stabilize your condition. First priority: hydration. Use oral rehydration salts if you have them, or safe bottled water mixed with electrolytes. Rest in a cool, comfortable place. For mild stomach issues, follow the BRAT diet: bananas, rice, applesauce, toast. Consider over-the-counter options, but only if there's no fever or blood. For fever or pain, acetaminophen or ibuprofen as appropriate, respecting dosage limits and any allergies. Early stabilization prevents escalation in 70 to 80% of mild cases. Organizations: ensure that travelers carry a basic individual first aid kit. Step 3. Contact your travel insurance provider's 24/7 assistance line immediately. Most comprehensive policies include emergency medical coordination. Give them your policy number, your exact location, symptoms, and the situation. They can direct you to vetted, English-speaking facilities, arrange direct billing where possible, or guide evacuation if required. Something important to note: even primary health plans rarely cover treatment abroad. Out-of-pocket payment is standard, with reimbursement later. Delaying this call risks ineligible claims or suboptimal care. Keep your policy details and the assistance number accessible. Carry a digital copy plus a printed backup. Step 4. Seek appropriate medical care based on severity and the guidance you received. For minor issues, start at a local pharmacy. Many countries allow pharmacist consultations for equivalent over-the-counter remedies. For moderate symptoms, visit a recommended clinic or urgent care. For severe or life-threatening situations, chest pain, severe dehydration, trauma, go directly to the nearest hospital emergency department or call local emergency services. Organizations should pre-identify quality facilities through embassy lists, the International Association for Medical Assistance to Travelers, or your insurer's network. Avoid unlicensed providers. Step 5. Contact the nearest U.S. embassy or consulate if circumstances necessitate additional support. While the U.S. State Department does not provide medical assistance, they maintain lists of English-speaking medical providers. They can facilitate communication with family or employers, assist with fund transfers, and coordinate repatriation in certain cases. In remote areas or during crises, some embassies may offer essential navigation information. Enroll in the Smart Traveler Enrollment Program, STEP, in advance to ensure a more efficient response. Step 6. Document everything meticulously for insurance claims and follow-up. Obtain itemized bills, receipts, medical reports, prescriptions, and diagnoses in English whenever possible. Photograph everything. Request copies of tests or notes. This documentation is essential. Most insurers require proof of payment and treatment details for reimbursement. Organizations should require travelers to forward copies promptly for duty of care records. Step 7. Initiate medical evacuation or repatriation if local care is inadequate. In severe cases, surgery needs or limited intensive care capacity, transfer to a higher trauma level facility or return home may be necessary. Your insurer coordinates this, and it is often the most expensive benefit. Typically, up to $100,000 of coverage or more is recommended. Without dedicated evacuation insurance, costs fall directly to the traveler or organization. Conducting a pre-trip policy review should be standard before each trip. Step 8. Follow up with your primary care provider upon recovery or return home. Even illnesses that seem resolved can have delayed effects, post-infectious fatigue, parasitic issues, and more. Share your travel details, treatments received, and any lingering symptoms. Seek evaluation if fever, persistent diarrhea, or other issues continue. Organizations should mandate post-travel health checks for high-risk trips to close the loop on exposure tracking. To summarize the protocol: assess severity, stabilize, contact insurance, seek care, engage embassy if needed, document, evacuate if required, and follow up. This structured approach minimizes disruption, protects your health, and fulfills professional responsibilities. Thank you for your attention. Travel prepared and lead responsibly.